Dave Scott, Hub Media. Today I'm chatting with Dr. Amber Mcknight, and I always forget where it is you work. Where is it?
Simcoe Optometric Clinic.
I'm just teasing. I know where it is. Today I want to talk about dry eyes. It's a problem I have in the winter. I don't know what causes it, and I don't know what to do about it. So I'm hoping you can help me out and give me some advice on this scenario before it gets too deep into winter and I'm having this problem again. Fire away, Dr. Mcknight.
Well, you're definitely not alone, Dave. That's pretty common that as the weather gets colder, the air gets drier inside, but the heat coming on, it gets breezy, if you're outdoors and cool, that your tears just aren't protecting your eye like they do in the summer. You've got this layer of tears on the surface of your eye, different than what you get when you cry. It's actually a mucousy, oily layer that's spread out, protects the surface. Probably in your case, if you find it's worse in the winter, your tears are evaporating faster than you're making them, and it can create symptoms like itchy, irritable eyes. They might be red. Things may go a little bit blurry on you. You may find when you wake up in the morning, they're a little bit crusty. Just overall, kind of uncomfortable. Sometimes we'll even feel like you have gravel under your eyelids when you blink. I would imagine those are probably some of the things that you're noticing.
Yeah, sounds exactly like it. Yep.
Yeah. The tricky thing with dry eyes is that it can be really hard to know exactly why you're having the symptoms. The best thing is to, come in, we'll get you in for that exam and we'll take a look. But it may be that you're not producing enough tears. It may be that you're not producing the right quality of tears. Maybe the tears don't have enough oil in them or enough mucus. You might have some underlying inflammation that's causing that problem. It may be linked to medications that you're taking or other underlying health conditions that you have. And if you're like most of us that are on screens, probably increased screen time. We're on screen right now. It's amazing, but when you use a computer screen or your phone or a tablet, you won't blink as much as what you would normally. So every time you blink, you're producing new tears. So that reduced blink rate results in tears evaporating faster than you're generating them. And then that cascade of symptoms where things go blurry, feel itchy, feel irritated, and may water a little bit.
Is that does it come with age too? I'm just curious. Not that I'm old.
Yeah.
I'm just wondering.
No, not at all. Yeah, definitely. The older we get, just naturally, our eyes don't produce tears like they used to. So that definitely complicates things for sure.
And you and I were talking before we went on air today, and just some of the other things that can influence dry eyes. And you were telling me from medications to there's quite an assortment, isn't there?
Yeah, that's part of the mystery of trying to treat your dry eyes is figuring out what's causing them. Medications, some blood pressure medications, some antidepressants, allergy medications, some birth control medications, and a few other classes can influence dry eyes. If you've got underlying rheumatoid arthritis or lupus or Sjogren's syndrome, that can also cause decreased tear production. So part of the exam when you come in, we always screen people for dry eyes, ask questions about your symptoms, about your history, ask questions about your overall health, medications you're taking, the amount of time you spend on a screen. And a lot of times we'll try and quantify the symptoms that you're getting. Your optometrist will look at your tears, measure the type of tears you have, do a few extra tests for dry eyes, and then craft a treatment regimen that's kind of specific for you.
So what are some of the different types of treatments then? Like, can you give us some examples?
Yeah, sure. Definitely, it will vary from person to person, so it's best to get some personalized advice during an eye exam. But for sure, adding extra tears onto the surface of your eye with lubricating drops. We always recommend preservative-free artificial tears. They're available without a prescription. We've got some really great ones here in our clinic, or you can pick up some from your pharmacy. Anywhere from 2 to 4 times a day to put in some extra tears just to supplement what you're producing on your own. That's always a good idea.
Okay. It's an interesting subject, really, because you don't, like you said, you don't really think about it until something goes wrong. And then you sort of recognize, oh, my eyes are just dry, but you have to be careful with it, and you've got to take it seriously, correct? You just don't want to leave it.
No, that's true. I'll usually tell people you shouldn't really feel your eyes. You shouldn't be thinking about your eyes during the day. The comfort should be there that you don't even really think about it. So if you're pausing to rub them or blink more, or they are feeling irritable, odds are you've got some dry eye symptoms possibly. Of course, there's a few conditions that kind of mimic dry eye, so your optometrist can figure out exactly what's going on. But it is important to treat it because over time, it can get worse. The glands that produce your tears can atrophy. And of course, as you get older, you produce less tears anyway. So getting a handle on your dry eye symptoms early is the best for the future, and also to keep you comfortable.
For sure. And like we talked about last time, if you have some of these signs and symptoms, you should definitely give Amber a call. Can you give us a quick plug on where you are, phone number, email, how we get a hold of you?
Yeah, sure. You can call us at 519-426-3123. You can visit us on our website, simcoeoptometrist.com. We've also got some extra information about dry eyes on our website. And you can purchase some dry eye treatment products on our website as well. But definitely, we're happy to see you, take a look at those eyes, and get you feeling better soon.
When you come in for a checkup, do you guys notice if there's a possibility of dry eyes? Is that part of the checkup? I think you said that, right?
Yeah, definitely. We're always screening people when you come in. We'll ask some symptoms, and we'll take a really good look at your eyes with the microscope, do some measurements of your tears. And again, it's such a widespread problem, and sometimes a problem people don't realize that they have or realize that there's a fix for.
When you said it's a widespread problem, is it basically generally, 90% of the population gets this, or is it just, I don't know, I'm just curious.
Yeah, so the numbers really vary because symptoms can be mild through severe, but estimates are at any given time, probably up to 25% of the population is suffering with dry eyes, and at least 70% of us at some time in our life will experience dry eyes.
Thanks for doing this. Always fun. I always learn something new, so we'll have to get together again and do this. But thanks for taking the time today. I really appreciate it. I know you guys are always busy there, and when we get a chance to chat, I always learn something. I don't think you learn much because you got to listen to me, but we'll keep working on it. Take care, okay, Amber?
Sounds great. We'll see you soon, Dave.